Hello, hi everyone. Good evening and good morning. And we have a special guest today, one who is very important for my Chinese medicine career and inspiration. I was really lucky enough to meet him during my first year when I ran away from school to join the local conference, and he was teaching there. My mind was blown up, and I said, I don't know what I do in school, but this is what I want to learn. And unfortunately, sometimes we have to learn 4 years until we can go and learn with him. But just to put you in the loop, if you don't know him, he started back in the 80s. Please correct me wherever I'm wrong. I think started back in the 80s in Japan, studying shiatsu first,
That's
and
true.
Japanese meridian therapy, and then coming back to the roots of Chinese medicine. And I think now it's almost 40 years of career.
No,
As
not so much, not so much. Just over 30, actually. I was just thinking today that I just turned 60. So officially, I'm more years an acupuncturist than I was not an acupuncturist. So,
That's amazing. So
yeah.
let's keep you young. So he's only been treating people for a little bit more than 30 years, which is still longer than he was not an acupuncturist. And I think you bring in your clinician to all your teachings, and your teaching really focus on 5 elements and constitutional therapy. And if you are lucky enough, you can learn with Rani pulse therapy diagnosis and face diagnosis, and really go deep into the depths of classical Chinese medicine. I would say, and you can again correct me later, and really specializing in treating complex diseases, among many other things. And today we are here because Rani has many classes with us, and many are forthcoming. I hope some of you have seen it and you know him from this. Many know Rani because he's one of the authors of a great book, which is more than a decade in the making. And we still get a lot of questions about when is the book coming up every time somebody watch one of the free classes about one of the acupuncture points. But the latest class is called When Rain Pours Down from Heaven, and it focuses on extraordinary meridians in treatment of autoimmune diseases. And we are here to talk about this today. And when we first spoke with Rani about doing this class about the extra meridians, he gave us really beautiful titles, and we were so excited to hear. He called them the Holy Trinity, Awaken the Inner Child, the Sum of All Fears, and it was like mind-blowing to
And
see
the
them in
sex, drugs, and rock and roll, don't forget.
sex, drugs, and rock and roll. You can already start to guess which one is which meridian. And eventually we settled on slightly different names. So Rani, actually, first, thank you for joining us today. And I want to really start and jump straight into the depths of it without too much stuff. What are the extraordinary meridians, and why they are called extraordinary meridians?
Oh, that's such a simple question, isn't it?
I knew it.
Um, Well, I'm very happy to have this discussion. I really wanted for a long time to give a series of classes about the extraordinary channels, and I'm going to say a bit about them in a minute. But first of all, the reason I wanted to really get into the extraordinary channels is that this is really the metaphysical infrastructure of life, you could say. It is the model, the apparatus through which the energy of heaven, the energy of creation manifests and enables the creation of each and every one personal human being. So this is very important about the extraordinary channels, because the extraordinary channels, we say, you've probably all heard this in your classes and your studies, the extraordinary channels have to do with the flow of Jing through the body. Or actually, we could say the transformations of Jing Shen that go out throughout life. And this is actually what makes each and every one of us unique from the beginning. And I'll say even more than that, the extraordinary channels actually have to do with Yuan Qi. And Yuan Qi, most acupuncturists know Yuan Qi because we have Yuan source points, and we say this is the source Qi of the person, has to do with being stored in the kidneys and manifests through the three heater or sanjiao or whatever you want to call it. But actually, there are two different kinds of Yuan Qi, and the Yuan Qi that we're talking about that has to do with the extraordinary channels is actually what we call the Yuan original Qi. It's the original Qi of life. You could say it is the breath of life that is flowing through everything within the created universe. And within the model of creation of human beings, this original Qi actually flows and animates and creates this very basic infrastructure of life that we call the 8 extraordinary channels. Now, why are there 8 and why are there extraordinary? Let's first begin with the extraordinary. Extraordinary actually means that they have to do not with the regular flow of qi and blood and transformations of fluids and substances in the body, but actually, as we said, that they're the infrastructure that is behind this, creating the process and regulating and ordering the process of development throughout our lives. And 8 is a very important number in Chinese philosophy, I think in any kind of philosophy, because in all philosophies, when we think of the 8, we can actually think of the 8 directions which create the time-space structure that we define as reality. So when we speak of the 8, we have like the 4 cardinal directions of north and south and east and west. And we also have the 4 corners of life. So when the Chinese talk about anything that has to do with being created by 8 different aspects, they're actually saying the 8 actually enables the manifestation of all of the different possible creative aspects of life. Anything that is created can be understood within the 8. That's why within Chinese philosophy, first of all, before we talk of Chinese medicine, the 8 has very much to do with what we call the Bagua, the 8 trigrams, which describe, according to the very basic Chinese philosophy, what is the created life, what are the different manifest powers or characteristics that enable a created life. So when we speak of the Ba Mai, of the 8 extraordinary channels, we're talking about this pre-heaven level, or this transformative ability to transform from the pre-heaven into the post-heaven created life of each and every one of us. And there's actually a very interesting kind of analogy that you can do within the creation of the Ba Mai. If you look at the process of the cellular embryology, how life is created, how the sperm and the egg meet each other, and the very first divisions within this fertilized egg can actually be compared to the 8 Ba Mai. So all of this process of division that happens from the moment of conception and through the first 3 or 4 or 5 days in which the fertilized egg is developing before it is planted in the uterus, which actually we could say is the beginning of a manifest material life, or the beginning of the development of manifest material life, this can be somehow compared to the 8 extraordinary channels. I think I mentioned this within our seminars. I'm not sure how much we got into that. So that's in general about what are the 8 extraordinary channels. And it's something that I've been fascinated with for many, many years, both at the philosophical level and at the practical level. And then through all our discussions, and you convinced me to make this seminar, and I was thinking, how can we make it also more practical, more clinical, not only the philosophy? So I decided that we have an extensive discussions about the extraordinary channels, but we try to also look at it through the clinical point of view. And I chose to look at it through the clinical point of view of autoimmune disorders and also hormonal disorders. This is not to say that extraordinary channels have only to do with autoimmune and hormonal disorders, but it's a good kind of looking glass to look into it and say, okay, let's understand the philosophy and see how we can take this philosophy and immediately make it practical for the clinic, for the diagnosis and for the treatment strategies and so on. So that's what I try to do in these series of seminars that we had.
Thanks. It does show the basic of what, yeah, it sounds like this is the really basic. It sounds like it's the basic Chinese medicine principles in a sense, the way you describe it.
Well, it's the basis of life. It's the basis of life, how life is created, how life is regulated, how life develops. You know, part of Chinese philosophy is that we're all here for a reason. We have our own karma. That's the Indian name for it. Chinese talk more about Ming, about destiny. We have our own destiny. We have these qualities, these unique qualities that we bring to the world, and we're supposed to do something with this. So this basic infrastructure of the 8 extraordinary channels, it really creates the working mechanism that enables each and every one of us to, on this, develop their own unique characteristics and bring their own, how do you say this, contribution to the world.
Yeah. And together with us today is my colleague, Patricia, who is really the woman behind everything you see in TCM Academy. So it's an honor she's willing to join us today in the front. Usually she's hiding on the back.
Behind the camera, but
yeah, but I forced you, so it's good you are here. So welcome to join us.
yes. And I have a question to Rani, because there's so many ideas about the extraordinary channels. I heard from some teachers, you shouldn't treat them or just with Qigong. It's even dangerous when you use them too often. You can create disease. And other teachers say, just open all at the same time, it's fine. So you give something in between and how you handle it.
So that's a good question. Let's look at it first from the historical point of view. The historical point of view, if we look at the early classics of Chinese medicine, we look at the Neijing, the Suwen, and the Lingshu, then the extraordinary channels are mentioned within the texts, but they're more mentioned as concepts or philosophical ideas and not really treated, as you say. So maybe part of what you're hearing is correct, that this is a very basic metaphysic infrastructure, and it's something that you should try to connect with at the chi level, at the mental level, at the meditational level, at the spiritual qigong level, whatever. I can totally connect with this way of thinking, but the reality of medicine is that medicine develops because there are diseases, there are problems. So we're looking for a way to treat these problems. So even when you continue with the history of the Chinese medicine and you get to the Nanjing, which is a few hundred years after the time of the Neijing, Nanjing already talks about the extraordinary channels as a system, and as a system that is utilized in the body to deal with extreme situations or with diseases that are not that you're not able to rectify in the usual ways. And then these diseases get diverted into the extraordinary channels in order that you are able to survive. So you're able to survive, but you start to develop these kinds of chronic internal imbalances and sickness. And this is actually why we took these seminars in the direction of autoimmune diseases, because autoimmune diseases can very much fit with this understanding of these chronic problems, that inability of the immune system or inability of the self to heal itself. And then you start to get this existential type of life in which you're all the time in survival mode, and all the time in disease, and all the time in inflammation, and all the time in overactivity of the immune system, and so on. But there's another part of your question that I really wanted to talk about. Most people, when they think about the extraordinary channels, they say, oh yeah, I know about these channels, and each channel has an opening point, and you always use two opening points together in order to connect two channels, and this is the treatment of extraordinary channels. But this is only a small part of the system of treatment. First and foremost, each of the extraordinary channels is related to a trajectory of points within the body. So we have the Renmai and the Dumai, the conception vessel and the governing vessel, that they have their own trajectory and their own points. But all of the other extraordinary channels, they're actually made up of connection between different points on different channels. So a big part of what I did in these seminars is actually looking at what are the points on each trajectory and why these points are related to a specific trajectory of an extraordinary channel, and how you can understand to use these points or choose these points even as single points, or as points that you add within your treatment strategy or your point selection. And when you do this, you are connecting to this energy of the extraordinary channels. So it's not just about the opening points. Actually, the opening points, except for kidney 6 for yin chao mai and bladder 62 for yang chao mai, the opening points are totally not related to the trajectories of the extraordinary channels. These are points that were actually combined with the extraordinary channels at quite a late time in the development of Chinese medicine. I think it's the 15th or 16th century, something like this is the first time that we have a textbook that talks about the opening points and using these opening or activation points for the extraordinary channels. And up till then, and actually also from then and onwards, we always need to understand the specific points related to the extraordinary channels, to the trajectories themselves, and how these points work utilizing this yuan qi, this original qi of this metaphysical system, in order to make a connection between the pre-heaven qi and the post-heaven qi flowing within the regular meridian system. So in my understanding and in my experience, and also in what I was teaching in these seminars, most of the clinical work we do with the extraordinary channels is understanding and utilizing these points that have to do with the trajectories of the channels and adding them, using them within our regular point selection. Now, specifically, when we talk about autoimmune disorders, or when we talk about hormonal disorders, there are kinds of specific protocols in which we can combine points of the extraordinary channels, or many times we use points that are meeting points of different extraordinary channels, like bladder 1, for example, or Dumai 26, or other points on the body that are meeting points of different extraordinary channels. And we combine this with activation points. but the activation points, not only in the common knowledge way of always using, for example, small intestine 3 together with bladder 62. So this is small intestine 3 is the activation point for the governing vessel. Bladder 62 is the activation point for the yang chow vessel. And in most textbooks and in most people's understanding of the extraordinary channels, these points are always used together. But what I showed in my seminars is that, first of all, you don't always have to use these points at all. Second of all, when you do choose these points, you don't always have to combine these two activation points. Using two activation points is very different from using one activation point, because two activation points already creates a kind of movement between these two different extraordinary channels. And sometimes you want that, but sometimes you don't want that. So we talked about how we diagnose this, especially according to the pulse diagnosis, in order to understand what kind of treatment strategy we want. And also I showed in the seminars that sometimes we combine different extraordinary channels. Like, for example, we can combine, Chong Mai and Ren Mai, not Chong Mai and Yin Wei Mai as is usually done. And this is something we use many times when we have problems of infertility, for example. So, so the important thing to understand is that we want to understand how the system works, and and when we understand how the system works, we can make combinations, we can make different combinations according to your diagnosis, especially according to your pulse diagnosis, in order to rectify chronic imbalances within the system. And this is how you can really have a long-term healing effect on very serious conditions like autoimmune disorders, hormonal imbalances, cancers, all kinds of different serious diseases that the body deals with over time but is not able to heal itself. And you can have a very effective and long-term effect of the treatment if you diagnose correctly and you make the proper connections according to your understanding of actually what's going wrong. So I really wanted to emphasize in the seminars not to get into this kind of thinking that there are protocols and there are specific combinations that always need to be used together, but to try to understand why these combinations are the most known and the most common, and also why there can also be other kinds of combinations depending on what is your clinical, what you want to happen for the patient.
I want to pick up on something that Patricia asked and something that you refer to, and it sounds to me, and please again correct me, it sounds like on one hand it's the basic of life, it's the structure, so to speak, of each human, and at the same time as we develop, and it's a reservoir kind of where the body is taking some shit and putting it away in those places. So it's both the beginning and a very basic part of our structure, but also like not a garbage because we don't throw this garbage, or maybe it is, we kind of collect it. And so it's both things at the same time, kind of. It's a bit confusing in this sense.
It is confusing. I think I understand it in such a way. The extraordinary channels create the basic infrastructure of life, of how life should be working, should be developing. That's why we say it's connected to the Yuan Qi, the original Qi. Okay, the whole idea of original Qi is that we can take this back to if you believe in God or in the Bible or something like this. This is the same kind of thinking of the breath of life that God gives over the waters, and this is the creation of life in the universe and so on. So that's the idea of this original Qi. So original Qi is always flowing. It's not, it has nothing to do with me, nothing to do with you. If you can be the best acupuncturist in the world, you're not going to create a tiny bit of original chi. The only thing that you can do is you can understand where things are stuck, how things are not working properly, and try to open the channels and open the possibilities for the original chi to manifest itself. Because flow of original chi is life, is health, is how things should be. So the basis of the extraordinary channels is this is the system that enables the creation of a perfect life, you could say. Now, on this basic system, very important thing I always stress with my students and with myself in the clinic, it's a thing that we constantly need to remind ourselves, I constantly need to remind myself, we treat the person, we don't treat the disease. And when we say that we treat the person, we actually mean that we treat the person's experience of life. How I experience life and how you experience life is very different. Even if we talk about the same things and we use the same words and the same concepts, you're never going to understand exactly what I mean. I'm never going to understand exactly what you mean. We can live in the same space, but our experience of reality is totally different and totally unique. This is not to do with the extraordinary channels. This has to do with what we call the constitutional level or the constitutional destiny that you are born with. So this has very much to do with the philosophy of the 5 phases and the stems and branches and this level of experience of life. So I got to this by saying that we always need to remind ourselves that we want to treat the person and not treat the disease. So most of what I do in the clinic and most of what I teach and most of what I emphasize is to really understand what is the experience of the person and how can I connect to their experience of life and to help their life to be better in the way that is right for them, not right for me. And so this is the important part of treatment. This is what we call the transformational aspect of treatment, to really help the person to become better within themselves, to better manifest themselves, to fulfill their potential, to fulfill their destiny, we could say. Within this idea of treating the person, many times we can diagnose that the problem manifests itself within a certain framework, within a certain channel, within a certain function, which is not working properly. So within the treatment strategy of treating the person, I will choose to add 1 point, 2 points of an extraordinary channel, or maybe one of the activation points and a point on the channel, and try to really combine the information that I'm giving the body of the patient into an information which is both supportive for helping the person to come back into themselves and to be most comfortable within themselves, and also to direct the treatment specifically to the area of disease or dysfunction, or however we want to call it.
I like this philosophical level, I have to say. And it is like really looking for the root of disease and whatever, everything which we like to say about our medicine, that we are looking at the person and then but if we take it back to the practical life of us, and Patricia asked before, and we can already understand that you are not afraid to treat those channels or these basic structures. Is it something you use more or less than normal points, so to speak, or is it something you come to with reverence? You are like, okay, I take my time before I decide to use it, or is it just another tool that is
Well,
great?
first of all, First of all, I think this is personal. So I'm going to say how I feel about it. Different people can have different ideas. I like the idea of treating it with reverence. Treating it with reverence for me means that I'm always taking into account that this is a very, on the one hand, very basic infrastructure. On the other hand, it's very non-substantial. So it's a very metaphysical level, and the changes that can happen at this level can be quite strong, dynamic. And one of the things I remember, I was taught this many, many years ago, and it's been with me since the beginning with the extraordinary channels, especially when you do treatments which have to do with using activation points or combining activation points of different channels together with points. Many times with the extraordinary channels, it's like Pandora's box. You know what is the condition before you begin. You're not always sure what's going to happen. So I want to combine this with what we said before about making sure to always remember to treat the person and not the disease. It's very rare that I will choose to treat extraordinary channels in the first treatment, or maybe even the second or third treatment that I see a patient. Even if the patient has come in with an autoimmune disorder, and even if I already diagnosed from the pulse that there is this problem of imbalance within the extraordinary channels, I want to give the opportunity to create a more balance, to clean the aura or clean the system of the person and help them to feel more comfortable within themselves, which is very much a 5-phase way of thinking about treatment. And then when we do this, I know I have more confidence that even if we now tap into this basic infrastructure of the extraordinary channels, nothing very serious or very unexpected is going to happen, because the person is already more balanced and more flowing within their own unique constitutional tendencies. So usually I would say not in the first 2 or 3 treatments, especially if you want to use the combinations or the protocols that I talk about in the seminars for specific autoimmune diseases. I would really say take the time to help the person feel better from where they are, which is a combination, I think, of both acupuncture and dietary advice and a bit of talking about what's going on in your life and what are your expectations and how can we help to help you to feel better about yourself and better about the direction you're going into. And then you can utilize these deeper treatments, and you don't always know exactly what's going to happen, but if you base your diagnosis on the pulse diagnosis, and within the seminars I talk a lot about pulse diagnosis specific for the extraordinary channels. I think this is very important, and this can guide you to get better results and not to have adverse reactions to treatments.
Would you then just generally do one extraordinary treatment and then continue with normal treatments, or would you do a few sessions considering the extraordinary? Can you explain it?
If my diagnosis has been accurate enough, then yes, then doing an extraordinary treatment within the process of the first few treatments and then an extraordinary treatment, it should create such a dynamic change which we can feel within the pulse, and the patient should feel in the symptoms getting better, especially symptoms of chronic inflammations and pains and all kinds of hormonal imbalances and so on. it should make a big difference. And if it makes a big difference, then we don't want to do this again. Definitely not too soon. In general, I tend to look at acupuncture as an educational treatment. We want to teach the person, the physical, mental, spiritual, holistic look at the person. We want to teach the person to find the balance and to find the dynamic of development and healing. And if the body mind learns this lesson correctly, then there's no need to repeat the lesson. So we need to think of what should be the next lesson, not try to do the same lesson again.
Speaking about education, it's good time to ask because my experience since I'm working with the TCM Academy and meeting so many students from around the world, or practitioner actually, people who already practice, and you've been teaching all around the world or in many, many places for a very long time, it seems like not only we are getting different education about it, it's also very minimal in a sense. It's like I just spoke yesterday with some student, and she said, "Yeah, this semester we are a little bit learning about it." And in
You're
my
talking about the extraordinary channels.
yeah, about extraordinary channels. And in my own studies, we heard about it all the time, but then in the third year, suddenly there was one semester where there was a little bit teaching about extraordinary, so channels and how to use them. So is it because of this so-called danger or reverence that we need to show to it? Is it a lack of, in your opinion, of course, lack of knowledge among teachers themselves? Is it too complex for students, or why is it?
Well,
It's so basic. It sounds like this is the basic of what we need to learn, actually. We should start there.
It is, but it's also very complex. And the problem, I think one of the problems is, well, first of all, we are now the teachers, but not so many years ago, we were the students and we didn't learn so much about it either. So it takes time and it's a developmental process of learning. I think one of the problems as students, as human beings, we all have lack of confidence, lack of security. Especially as students, we have a lack of confidence, and because of this lack of confidence, we tend to attach, we tend to cling, tend to hold on to things that we learned, and we said, "Oh, this I learned, this I know, this I use. Don't bother with me with the facts. This I learned. This is how it should be. I don't want to confuse myself with too many other things." And and specifically this system of the Baomai, of the extraordinary channels, it is complex. It is complex to understand. It is complex to be able to accept that things are not as clear-cut and structured as we would like them to be as students or as beginning practitioners, where we need to have a firm grasp on what we know in order that we don't get confused with too many different things. So I like it that it took me so many years before I was ready to make this kind of series of seminars. And I think also that most of the people that will feel this contribution from these seminars, maybe they're not at the student level or the beginning level, or maybe they can hear it for the first time when they're at the student level or beginning level. But there's so much information that every time you come back to it, you will suddenly understand new things and more things. And this is how Chinese teaching is. It's not a direct path. It's a circular way of teaching. We learn something, we think we understand it, we go through a period of development, we come back to the same subject again. We understand that what we thought we understand is totally bullshit, or only a little piece of the big picture, and we can now see a bigger picture, and so on and so on. I've been in practice for more than 30 years. I've been using the pulse diagnosis almost exclusively as my diagnosis for 25 of these 30 years. I'm quite good at it. I'm quite proficient at it, but still you talk to me now and you talk to me in a few months and I'll be able to say, well, I had this sudden understanding of something that changed my whole outlook on the whole picture. And this is a constant process of learning and development. I think it's fine. I think it's fine that we begin with basic understanding and then we come back and we come back again, and every time we can develop more.
Yeah, I can confirm that. I did that class about extraordinary channels with you many years ago in Germany in a live class. And now I was watching it again and, oh, that's interesting. That's interesting. I'm sure you probably said the same things there, but
I probably, if for you it's changed, and also for me it's changed, because probably I said the same things, but my understanding of what I said, and so my ability to convey this understanding to you is changed. It's changing all the time. You asked me before, Guy, about the names. In the beginning, when we talked about this series of seminars, I didn't just want to call them, oh, this is the Dumai, this is the Renmai, this is Chongmai, and so on and so on. I gave the 5 different lectures, or the extraordinary channels, the way I divided them between the lectures. I gave them different names because I wanted to try to show that they really have to do with these very basic aspects of how we define our lives within ourselves. So, for example, the first seminar, we have an introduction seminar, which we called When Rains Pour Down from Heavens. This is actually a quote from the Nanjing and has to do with this level of understanding that we talked about, that the extraordinary channels can be reservoirs for times of extreme situations. So that's what that Nanjing means when they say rains pour down from heavens, and all of the waterways, all of the channels are overflowing and clogged, and there's no way to deal with the situation. And then the extraordinary channels come into play as these reservoirs that can take in these excesses of xie, of pathogenic qi, and allow the system to come back to balance. So that was our introduction. And then the first lecture has to do with the 3 heavenly channels, I call them. This is the Chongmai and the Dumai and the Renmai. The Chongmai, the governing vessel, and the conception vessel. And all of these 3 channels, actually, they all begin from this center focal point, which is the beginning of life. And this also has to do very much with what I talked about before, that we can make an analogy between this creation of the system of the extraordinary channels and the embryology of development of life. So all of these 3 channels, they begin from what we call the Baozong, the central envelope, the beginning point from which life begins its first specification, you can say, and cells are replicating, and life begins to grow and to develop and to manifest. So I call this first lecture, I called it the Holy Trinity, because it has to do with really beginning from this place of undifferentiated Yuan original Qi, which is the Chongmai. And then we have these 2 aspects which give us perspective, can show us perspective of this first original Qi. And these are the Dumai and the Renmai, the governing vessel, which oversees and regulates all processes within the body, and the conception vessel, which has to do with conception and fertility, but not only in conception of fertility, it actually has to do with Renmai actually means to bear the burden of life, to be able, I say, in my understanding, I very much like to try to combine Chinese energetics with our Western scientific understanding of life. And in my understanding, I say that the Renmai has to do with everything which is metabolism within the body. So everything that has to do with the processes of transformations of energy into matter, into substance, substance into energy, all of these changes. So it has to do with the breathing, it has to do with the digestion, it has to do with the fertility, it has to do with all of these different processes of metabolism which are happening within the body. So these three are what we call the Holy Trinity, the heavenly blueprint of how life should be. And then we have actually the four channels, the four extraordinary channels, which actually begin from the legs. So I could say if the first three, the Holy Trinity, are the heavenly order of how life should be, then the four channels of the legs, which are the yin and yang chao and the yin and yang wei, they all begin from the legs. They all begin actually from earth. And they're much more about the process of developing and becoming who I am. So, for example, let's see if I remember the names I gave to it. Let's begin with yin and yang wei mai. Yin and yang wei mai are the sum, the synergetic effect of all of the processes that we go through in life. Especially with the yin wei mai, really nice way to look at the yin wei mai. If you look at the trajectory of the yin wei mai, you can actually see that the points along the trajectory, they kind of hint at the developmental processes that we go through life. So yin wei mai begins from kidney 9, and you all know that kidney 9 is this very special point that we use in order to help with the conception and to help with the development of the baby within the uterus. So it's very much this kind of supporting point for creating a proper environment for growth and development. But this also means that it can be used not only for treating pregnant women and taking care of the pregnancy. We also use kidney 9 through this same quality in many kinds of other developmental imbalances, like hormonal imbalances or autoimmune disorders. I talk about this within the courses, so we're not going to get into that. Yang Wei Mai, on the other hand, has to do with how we interact with the exterior world. And one of the interesting things that within the Ling Shu, I think it is, when the classics talk about symptoms of imbalance of the yin and the yang wei mai, they don't say much, but one thing that they do very much emphasize is that when there's an imbalance within the yin and yang wei mai, the person never feels comfortable within themselves. They're always stressed, always not knowing what's going to happen, not knowing how to deal with what's going on in the life. And if Yin Wei Mai is the kind of record of our development through life, I'm sorry, I didn't say that before. We talked about kidney 9, but I wanted to say something about the trajectory of Yin Wei Mai, because kidney 9, we could say, is the beginning. So this is the point of conception or inception or supporting the beginning of life. And then the points of Yin Wei Mai, they travel up through the spleen points and up to the liver point, and actually up after that to Renmai 22. And these points can be seen as what's going on through the different stages of life. So, for example, spleen 13 and especially spleen 15 has very much to do with the hormonal changes of adolescence. And liver 14 has very much to do with the hormonal changes of menopause or adrenopause. And Renmai 22, which is the last point of the Yin Wei Mai, has very much to do with coming to terms with yourself and how do you express yourself, or how do you feel in your ability that you have you been able to express or to manifest your destiny during this lifetime. So Yin Wei Mai and Yang Wei Mai, they have a lot to do with how we experience the reality of life, and how we experience the reality of life all through our lifetime. So that means they have to do a lot with time. And Yin Wei Mai, pathologies of Yin Wei Mai, one of the classic things that the books say about pathologies of Yin Wei Mai is that when they have problems with Yin Wei Mai, they're always caught up with things in their past that they didn't do right, they could have gone right, all of these different problems that we all have that we talk about, we caught up in our past all the time. When you have problems of Yang Wei Mai, that means you're all the time in tension about what's going to happen in the future. How are you interacting with the inside, with the outside world? How can you prepare yourself for all of these terrible things that are going to happen? So that's why when I was thinking of a title for these Yin and Yang Wei Mai, I came up with the sum of all fears, because really pathologies of the Wei Mai, they are pathologies that they cause us to be all the time within this state of mind of fears and tensions and all the terrible things that could have happened and all of the terrible things that happened before. And because of these terrible things that happened before, my life will never be as I wish that it should be, and so on and so on. So this is the Yin and the Yang Wei Mai. And when we talked about the Yang Chao Mai and the Yin Chao Mai, these have very much to do with the here and now, with the timing, with what's going on at this moment. Am I able to bring my energy downwards and inwards and root myself and nourish myself and make myself more stable and confident in my life? This has very much to do with the Yang Chao Mai, bringing the energy downwards, directing Yang Qi downwards into the Yin. And whereas Yin Chao Mai is much more about, do I have the resources in order to take on responsibilities or take on things that I'm going to do in my life? So Yin Wei Mai has very much to do actually with taking the energy of the root and sort of warming it and pushing it upwards and pushing the yin upwards, pushing the fluids upwards, pushing the nourishment upwards, all the way up from the bottom, all the way to the brain. So Yin Wei Mai, we could say it brings yin to the brain. Bringing yin to the brain actually means calming down and looking more into yourself and taking responsibility and taking time to meditate on, am I in the right place? Am I doing the right things in life? And so on. So for Yin Chao Mai, we said awaken the inner child, because it really has to do with, I could even say forgiving yourself, but it's forgiving yourself because you're going through this process of taking responsibility and introspection and looking inwards and finding this acceptance of yourself. This creates calmness and the ability to continue onwards. And Yang Chao Mai, pathologies of Yang Chao Mai are pathologies of ego, and they're pathologies of impulses, and they're pathologies of I want this and I want it now, and I want to experience it as strong and as powerful as possible, and so on. So that's why I called it sex, drugs, and rock and roll. It's not just about sex. It's not just about drugs, and it's definitely not about rock and roll, but it does have to do with this state of mind that I, and I imagine many of you also experienced as younger adults, in which we're all the time don't want to be bothered with ourselves or with our morality or with what we know to be the correct and responsible thing to do. We just want to experience things to the extreme. And this is very much a kind of picture of imbalances within Yang Chao Mai. And which one did I not talk about? Dai Mai. Well, Dai Mai is special. Dai Mai is the only channel in the body which is a horizontal channel. And it's actually the channel of bringing everything together and making everything work properly together in order that there's a synergy between all of the different functions of the body. That's why we say the Dai Mai, we call it the belt channel, but it's not just the belt that's holding up your trousers. It's more like if you think of the ancient Chinese garments, which were more like a kind of robe, which is a big cloth that goes all around the body. And the only thing that enables this robe to be a comfortable clothing is this belt or this girdle that keeps everything in place. So it's not just about the area of the belt, it's about that through this energy of the belt or the girdle, everything flows properly, and you can walk and you can run and you can work, and you don't need to worry about your robe falling off or your pants falling off, and you feel comfortable within yourself. So we called this chapter on the Dai Mai, we called it When the Shoe Fits, which is a very famous Buddhist poem from I don't know when, which actually says when the shoe fits, you don't think about the shoe. It's comfortable, it fulfills its purpose. There's no issue with the shoe when it fits properly. So this is how Dai Mai should be working in order that there are no issues, that we're not conscious of any kind of problems in the body.
These are beautiful. I think I really like them because they make these concepts really alive. It's easy to remember. Now everybody goes. And I think about them, I always think about this guy from Asterix, this fat guy, what his name is, I don't remember. He's really holding here everything together, otherwise he will not be able to run around. Rani, this has been beautiful, and we are really nearing the end, kind of. I still have one question from the crowd that I want to ask you, which is very practical, and two questions which I ask everybody who come to talk with us. If you have a few more minutes, then let's do it. So the question from somebody's asking, Miguel is asking, if you use those extraordinary channels on elderly people and children, and maybe people with less energy. So this is really the practical question.
Children, almost never. I treat quite a bit of children. Almost never. Sometimes in extreme cases, severe cases, like I had this child actually just 2 weeks ago or something come in with a very severe milk allergy, the kind of milk allergy that if they touch milk, they might die from anaphylactic shock and so on. And many times these kinds of severe food allergies have to do especially with the Dai Mai. So yes, I do remember that for this child, even though it was the first treatment. I'm doing everything I told you not to do, but sometimes I do. I did use gallbladder 41, and I think it was liver 13 together with gallbladder 41. But usually it's very, very uncommon to do that in children, and only if there's a really good reason. Adults, I do use, even older people, you can use extraordinary channels with. I go into this quite a lot within the lectures. And again, I want to emphasize that when I'm talking about using extraordinary channels, this doesn't automatically mean using the activation points. And definitely, it doesn't automatically mean using two activation points of two different channels. This is used only for very specific reasons, which I talk about within the seminars. But don't be afraid to use the points, or to use the points according to the pulse diagnosis, if it's the correct thing to do, only because the patient is very old or very sick, or sometimes it's the best thing that you can do to help the patient gain the proper energy, the proper order of the energy, which is this very basic infrastructure level of extraordinary channels, and that's what they need in order to heal.
I would say we can needle our own weigh my points, and then we lose all fear from the
Yes, and then you have no fears of doing anything wrong, and you can be more open. Yeah.
Okay, that's a good. And now I move just from the practical to two questions. One is for the many people who watch us, who are students or just beginning their careers, and like we said, you are now more time acupuncturist than non-acupuncturist. So if you look back on your own self 30 years ago or so, if you can give one tip to young students, and you meet a lot of young practitioners, what is the best tip you can give them moving forward?
The best tip I can give you is to apply yourself into what really makes you enthusiastic. Where is your curiosity? What are the things that really, really cause you to get excited and you want to get into them? And don't it you're not going to be successful fast. It doesn't happen. It takes time, it takes effort, it takes experience. The more you gain experience, the more you understand. The more you understand, you'll be more successful. I really don't like all of these systems of quick results. Use this protocol, will get a quick result, and so on and so on. I don't believe it. It doesn't happen. I think you get the quickest and the most effective and the most deep and long-lasting results when you are really able to diagnose and to understand who is this person, what is their experience, what's going on in their lives, what is their experience that causes the process that brings them to sickness. We're not treating the symptoms of sickness. We're treating the person whose body had no choice but to create this sickness. And we want to understand why the sickness is created. And this is what we want to treat. So study deeply, study pulse diagnosis. There is no other kind of diagnosis which comes anywhere close to the potential of the pulse diagnosis. It takes time, it takes effort, but the more you do it, the better you will become, and then you will gain more experience. And specifically, the pulse diagnosis for the extraordinary channels is not so difficult to learn. That's why within this course and the seminars, I even do some practical practice with the pulse, with feeling the pulse, because you can feel on yourself the different positions and the different qualities that I talk about. And that's the way to start to gain more and more insight into it.
Thank you. I think this is very helpful, and it touches on my next question. But before this, Patricia, you're here with me. Do you have a question? We can use this. We have Rani for us. We can ask anything.
Yeah, I thought like, what was in all your Chinese medicine? Do you remember one moment where you were just wow about something? Like that's it.
There were many moments like this. I'm very scientific in my nature. When I finished my military service, and I was thinking about what's going to happen with my life, and I went to the Far East on vacation and so on and so on. I was sure I was going to study Western medicine. I was already enrolled to medical school. I was sure that I was going to be a neurosurgeon, a brain surgeon, and that's what I wanted to do. And then the more I got into Chinese philosophy, I started to go more into Chinese medicine and so on. But still, in my mind, I was very critical and not really believing that it can work the way people say it might work and so on. And then I went through a very difficult period in my own personal life. My marriage was not going well, and I was going through divorce. And actually, I had already left my former wife, and I was in the beginning of relationship with who has now been my wife for the last 20 some years. But I was in a very difficult situation in myself, and I developed an autoimmune disease called Reiter's syndrome, which is a kind of joint arthritis. It's not a rheumatoid arthritis with specific antigens like rheumatoid arthritis, but it is a very painful, very debilitating inflammation of the joints and so on. And I was just on the verge, I'd been diagnosed, and I was on the verge of starting steroids. And at this time, I had already started my work as an acupuncturist. I was working in one of the hospitals, in one of the complementary medical clinics, in the first one in the hospital in Israel. And my dear friend and colleague, who was also in charge of this unit in the hospital, Yair Maimon, probably you know him. I asked him, "Can you give me a treatment?" And I still remember the treatment. It was a very simple treatment, not much thinking about it, not much believing. Yair didn't think. I talked about him later. He didn't think he can really do something with this autoimmune inflammation. He just wanted to give me a relief of pain or something. And I remember he did stomach 45 and spleen 1. And in 2 days, I was healed. And I was amazed. He was amazed. Everybody was amazed, and so on and so on. And suddenly I'd gotten my sign that this thing can really work, and there is the potential that this thing can work. So yeah, I have many moments of enlightenment, of teaching or ideas, but maybe this is the first thing that I remember that, made this change within me and said, "Oh wow, this can really work. I want to do this properly."
Thank you for sharing. That's fantastic.
Great story, Rani. Great story. And actually, it brings me back to my question with which we can finish. It really fits now. Time and space. This is my passion. You mentioned you got excited about the extraordinaries, and I think from the very beginning, it seemed to me that anybody can do stomach 45 and spleen 1 at any point, and it not always work the same. Or I can do on every patient stomach 36, and it's not, but there is a time and space where my chi and the patient chi, or other way around, and something happens. But it's not something you can learn or quantify. So how to What's your
Well, I
perspective
think you
on
can
this?
learn and quantify it. It's very much time and space is very much a very important part of Chinese medicine. And it's actually, it is actually the subject that the system that we call the stems and branches has to do with. But if you read through many chapters of the Neijing, you can see all kinds of quotes about um, when the stars align properly, when you are aligned with the chi, when you feel that it is the right moment for the right point, then you do the point. When I teach the stems and branches, which is the Chinese system of the fluctuation of energy according to time, you could say, we get very much into that. And of course, if the more you understand it, the more you can understand what is the correct time for treatment, when to expect that a patient can get better, when to expect that a patient can get worse. I think it's a very important level of understanding that there is the potential within Chinese medicine to really be a kind of preventative medicine, not only in supporting the chi of the patient, but in knowing to expect when things can get worse for specific patients and to choose times of treatment accordingly.
Perfect. So it's just in the books. Go and read the books.
Good.
Rani, thank you very much for joining us today. And thank you everybody who is here and everybody who is watching this recording. And go and visit Rani teacher page. There are many paid courses and Rani is very generous with his teaching. So there are a lot of free courses there where you can learn and get to see more. And if you're feeling inspired to learn more about extraordinary meridians in depth and use them, especially for autoimmune disease and hormonal conditions, but in general, then go there and yeah, we really invite you to check this out and to spread this medicine around. Rani said he used to be a student, now he's teaching and he's still a student probably. And
definitely.
once you learn from him, take it out there, help the people in your community and share, become a teacher.
Great. I hope and be a practitioner and help your patients. And I hope this lecture and the lectures that we give in all of the teaching, it helps people to become better practitioners so they're able to help their patients more. That's what we're here for.
There's a lot of thank yous and hearts in the chat, so
thank you, everybody.
Yeah. Thank you. Goodbye.
Okay. Bye-bye.